is being recorded.
All right. Good afternoon and welcome everyone to the 12:30 session of Mind Genomics Empirical Insights. The right communication in a key part of the recovery session. I have a couple of quick announcements that I just want to make. So please be sure to look at the chat to find the links to complete for our YVM survey, which is open to anyone between the ages of 12 and 30, and our policy survey, which is open to every attendee. And now please welcome the team from Mind Genomics. But first and foremost, I'm going to introduce Ken and Ron.
Hi, thank you very much. It's great to be here. I'm Ken Rotundo, President and co-founder of Mind Genomics Advisors. We're so pleased that you could join our roundtable discussion today. Clearly, all of you attending this event are passionately dedicated to advancing the recovery journey. We at Mind Genomics Advisors have developed a tool that empowers healthcare providers with remarkable insights into individual patient behavior. We have successfully improved patient engagement and outcomes in cancer screening, diabetes, depression, and other disease conditions. Our work has been published in the Journal of the American Medical Association. After collaborating with Greg Williams a few years ago, he encouraged us to apply our behavioral insights to addiction recovery. I'm confident this roundtable discussion will enhance and expand your ability to engage and preserve each life you touch in the recovery process. So I'll now turn our session over to our moderator, the Honorable Ron Klink. Ron, take it away.
Thank you, Ken. I appreciate it. And it's nice to work with you. So this whole thing started with Mind Genomics pre-COVID. The federal government, Medicaid, Medicare, and others were kind of throwing up their hands because the problem with opioid abuse and with overdosing and death had just become too much of a problem. And they were looking to see what was successful. And at the time, I was working with a gentleman named Matt Rumbaugh, who had put together a program down in Mississippi with the University of Mississippi and the state of Mississippi in the Delta, dealing with people who have one of the highest rates of diabetes in the country. So the question came to mind, what's the difference between somebody who eats 6 pieces of pecan pie and drinks a case of beer and somebody that's taking opioids? You're ingesting something that you know is not good for you, and it's a chronic condition. And so Matt and I got together and said, look, the same science and the same platform that worked and saved lives and saved limbs in Mississippi can work for this. And so we began to work together. And the Mind Genomics piece is very important. We approached Diane Chakal-Ra, who is working at the Greene County Treatment Center in the extreme southwestern corner of Pennsylvania. And Diana got it right away. She's helped us put together the science that came up with what we call a viewpoint identifier. You'll understand that more about that a little later. And then we went next door to Melissa Ferris, and Melissa is the director of the Fayette County Drug and Alcohol Treatment Center, and she has a lot. Not only do they do things within the county level, but she has private providers under her as well. So what we did, let me just start, Matt, with you, if you don't mind. You talk about the fact of doing what we call a 6x6 study, where you've got 1,000 people, you ask them a question, and you boil it down to 3 or 4 questions that then can give people a roadmap as to how the patient is thinking, or how anybody with any chronic condition is thinking.
Yeah, so what we did, so as part of our phase 3 study, we were able to come up with the motivating factors to keep a patient engaged into the recovery process. And that's where both Diana and Melissa's teams came in, because the subject matter experts are the patients that were in recovery, and they then took the study survey and applied it, which we'll have both of them talk about it today, as where they utilized it in their facilities, so that the end result will be an evaluation and management tool that will be a 4-question evaluation management survey, which will identify a mindset and persona based on motivational factors.
Now, interestingly enough, Matt, once that 4-question or 3 or 4 questions is established, there are billing codes for that. So Medicaid, Medicare, and some private insurers recognize that using this science, getting a roadmap to people's minds so that you know how to deal with them much quicker, there's a benefit to that. And so there are dollars that follow this science.
Yeah, because it's an evaluation and management tool, as long as it's being used in the clinical setting with the Diana and Melissa's teams, yes, absolutely, it'll fall under CPT code and reimbursement codes.
So Diana, you were the first one to jump off the deep end of the pool and take advance helping us do this. And the initial survey of we call 6x6, 48 questions, takes about 15 minutes to fill out. And you said some of the people who you were helping with couldn't read or write; they were illiterate. So you actually had to sit down. Your people had to sit down and actually read the questions. You had to think this is a massive undertaking and it's going to be a giant pain in the rear end. I guess as things went on, you determined that even the process of doing this was quite helpful. Can you talk about that?
Of course. When I was first approached by Ron and by Matt to participate in this survey, my thinking was I want to be open-minded. I have been working in this field and I would like to participate in anything that will enhance our work with our patients and the recovery process. So after I reviewed the questions from the survey, me and one of my colleagues, a psychologist, I decided that I would present it to my clinical team. And I kept in mind that our patients sometimes are in a hurry to get their medication or to go to some appointments they forgot they have just that morning. So we decided that we are going to implement the survey during our counseling sessions. And yes, at first we thought about it's a long survey, how it's going to go with our patients. But along with a cup of coffee and a donut, it seemed to be a very positive experience for us. And what at first we thought is just a questionnaire, we discovered that it's not a traditional survey and that it presented us with a lot of insight about the patient, and it gave us new tools on how to approach our patients. We have completed probably a couple of hundred of them, the surveys, and it became a very good tool for us as a staff member because it gave us a new insight into our patient's mind. It gave us new tools to work with during the counseling session. And we have worked with some of the patients for a couple of years, and yet through these questions, we found out information we were never aware of that became very important in their treatment and their recovery. So if the over 40 questions, it gave us so much information and so much insight that promoted a meaningful communication with our patients, we're very excited and looking forward to see what the 4 questions are going to bring us, because it's going to be a quick interaction, it's going to promote individualized care, and it is a scientific tool. Our goal is to participate and use this tool so we can eliminate the patients and the revolving door. We're hoping to be very successful in the recovery process.
Melissa, for people that don't know, Fayette County, Pennsylvania, you're right on the border with West Virginia and Maryland. And so therefore, people have heard West Virginia has extremely high levels of substance use disorder and overdosing. You see it, Diana, in Greene County as well. So Melissa, what did you see? We brought Diana and Amanda from their office over. They talked about their experience. You grasped this very quickly and took it to your staff and then began an outreach. Can you talk about what it was that you saw and why you were willing to take the shot at this?
Sure. So when we had the opportunity to talk with both you and Matt, and as well as Diana and Amanda, We first started with just a couple of our supervisors and discussing really what the survey was. Because I knew if we got the supervisors buy-in, it would be easier to get the staff buy-in. And our supervisors were kind of floored at the whole process. When they first heard survey, lots of questions, how long is this going to take me? The benefit of having Diana and Amanda there was to say, it doesn't take that long. It's 15 minutes. It may seem overwhelming and daunting, but really it's not. So we went through some of the questions, and then our staff were able to ask additional questions, and they were all in. So we very quickly then brought our whole treatment unit into a meeting, did the same type of presentation, and our staff are not the most willing to jump in and try something new, especially if it's something related to technology. We're just getting ready to go into an EMR. So I wasn't sure how this was going to work. And the presentation, they were able to ask questions, and our staff immediately they saw the value in the survey and what's going to happen when you get to the 4-question part of this process. When we were looking at it, there was a lot of discussion, and it surrounded with some of the questions. When you do any kind of evaluation with a client, a lot of times they tell you what you want to hear. The way this is set up, you're asked the same questions in different manners, but it's kind of the same tone. So you're really getting that validity. It's really showing that these are honest answers from a client that then will help gear to how you're going to be able to help that client. So after we started doing the surveys, which Matt has he's been fantastic. He's lived at our office 1 day a week, giving some technical assistance with our staff. But we started immediately with doing surveys. And so far to date, we've only had 1 client that's refused. Our clients see it as a benefit. It's part of our intake process. So the first step into treatment, and that really helps us because it gears the treatment plan, because you're really getting that client engaged. So we hope that in 2, 3, 4, 5 sessions, that client keeps coming. So if the client keeps coming, we're able to provide the services, we're preventing relapse, we're preventing overdose, we're preventing death. And also it benefits the agency because we're getting revenue back, which it's a business. But we were seeing our staff to be excited about the process. And when they're selling the survey essentially to the clients are like, okay, I can do this. It's not a problem. And it was exciting just to be able for our staff to be on board with something different.
Yeah, well, thank you. So Matt, you had something to add?
No, I appreciate the transparency of that, because the survey itself is not an I ask you tell, it's a statement followed by motivating factors. And what really, because I was so close to Diana's team and Melissa's team, the subject matter experts are those in recovery, and that they lended their voice to a phase 3 study that will complete and be a part of a tool that can be used then across our Commonwealth, extended out to those in New York, New Jersey, all through Appalachia. To me, that was just so empowering to see the shift in somebody who's in recovery being a part of something and empowering that individual. And we are getting true. I mean, they were utilizing the science before the final product, and that was amazing. So I just
just giving the questionnaire, they were learning so much. Now, I wanted to ask that question, and let me ask Diana first, and then Melissa, if you would add on. Diana, one of the things we heard from Amanda and some of your other folks is that you had people coming in, and as you asked the questions, as you mentioned, the questions are asked myriad ways, but you really kind of asking the same question. And they talked about one person, individual who came in and you talked to for over a year, and you found out the person was quite spiritual, but that was not the front that they put up when they walked in. Absolutely. And the person said, excuse my expression, this is bullshit. And then when he answered the same question the same way, different times, they said, my goodness, this is somebody who really is spiritual and so it was a different way to approach. You found out other people were motivated by not wanting to disappoint their family members. Other people, they didn't want to get reincarcerated again. What did it mean when you had that roadmap, you're sitting down to talk to somebody, instead of having a revolving door, the same people in, same people out, the monotony of just the same thing over and over again, when you actually had a roadmap to how to discuss the problems with these people when they walked into your office?
I think for us and for our patients, our experience is that we have seen light at the end of the tunnel. We felt like for a long time we've been going in circles, talking about the same things, but not being able to get too far, and discovering something that was so meaningful. I think it totally changed the way we approach the counseling sessions, the communication, the discussion. Patients felt empowered because they made a difference by answering these questions. And now because of that, we have a different approach in sessions that it's so much more meaningful than what we have done so far.
Melissa?
We have seen clients coming in more frequently. For us in our county, we've already surpassed the number of overdoses we did back in July for the entire year for last year. So we are in dire need for additional services, and any tool that we can use to be able to implement to get that engagement, we're looking for. And that was one of the reasons why we were so quickly to implement this process. We have seen clients feel like they've gotten their life back a little bit because they are able to drive their treatment. It's not us telling them what they need to do, because they gave us the information, but it's helping them to feel like that they are empowered to be able to help write their treatment plans. Because a lot of times we have a lot of legal clients at our office that don't want to be here. They don't think they have a problem. And essentially a lot of them have had a DUI and they think that they don't have a problem. But once they start to really, we get that mindset or that persona, when we get to those questions and we're getting some of those responses, we're able to dig a little bit deeper and then be able to shift some of that information back on the client. Well, you answered this way, so obviously you're thinking about this, and then trying to figure out how we can incorporate that into treatment. And it seems like it's making it easier for the counselors to be able to conduct sessions with clients.
Now, let me just mention too, we're only going to be able to hit in the time allotted a certain amount of issues related to this science and how it's used. We invite you to go to the Mind Genomics booth and get additional information. If you have questions, if there's follow-up information, we'd all be happy to talk to you and get you additional information. But talk about, if you can, to the two ladies, how does it matter how you talk to the person who's coming in, whether they are remanded by law enforcement or whether they're there because they want to be there, or whether they're there because they've been pressured by family, how you address them, how you talk about them, what you're able to derive from them? How does that make a difference in how effective your communication is? That's
everything. It depends on how you treat the person that you're seeing. I always say you want to treat the person like you want to be treated. And if you don't treat them with respect and you don't kind of we always say get to where your client is. You don't want to talk at them. So getting some of the information from the responses from the survey has been helpful to kind of find those little secrets or those little thoughts that you'd be able to incorporate, that you said this, and it also helps the client think, well, you're paying attention to me. Because we've had our clients, they'll sit there and they might do the survey, but it's more of they're talking to a counselor when they're doing the survey. So you're knowing some of the responses, which is helpful moving forward. It's showing that not only is the client is starting to be invested, but the staff member is being invested. If the client doesn't feel like you're invested or you don't care about them, they're not going to come back.
Matt, go ahead, Diane, please.
I feel on our side, I feel like the treatment setting, it's like their safe haven. And when they come in, they come with a lot of issues, and they come with a lot of stigma from their doctors, from their family, from the criminal justice system. So the way we approach them, it's what makes a big difference. So the patient can feel welcome, comfortable, feel important. And I think these questions helped us to reach to a personal level, that they felt they're like a human being and they're not an addict. They're not whatever the system is saying about them. So it was very personalized. And I think that what helps them get that leap of hope and motivation to keep going. And it's the same for us as a treatment provider as well. It felt that we are starting on a new path that is very exciting and very hopeful.
As we've traveled around, this kind of the elephant in the room, I think, for the people who do what you do, and bless you for doing it. Because if we didn't retrieve these people, we're just giving up on them. And it's not an easy job, but there's a stigma involved in what you all do.
Absolutely.
People say, oh, you're trading one drug, you're working a methadone clinic, you're trading one drug for another drug. And it seemed to me, as Matt and I have traveled around and we've talked to people who do this, they get quite excited about having a new tool. And it seems to lift that stigma. Am I wrong about that?
No, not at all.
Talk about that a bit.
I think it's because it refers to their persona, to their mind as a human being, and not as whatever the society calls them. And I think that's what makes a difference. They get back to who they are as a human being, not as a addict, not as a person in jail or whatever the society names them. And I think that's what is exciting. They feel important. They feel something. They feel a human being, and there is a hope that they can get well if they pursue on that path.
Melissa?
It's the same thing for us. We've experienced the clients feel like a human being again. And that basic principle of feeling like a human being, they're not being labeled as anything other than a person.
So the Mind Genomics science is now embedded in the MCare format. This is legitimate telehealth. Now, there's a lot of things that, we're like just talking to somebody on the phone and calling it telehealth, calling them up on the phone and calling it telehealth. But this is actually being able to get bio information back and forth, do geolocating. We know if a person, if we're working with law enforcement, we know if they're in an area where they shouldn't be. And since we know their personality, we know what kind of message to text them. We know what reading material to send to them. We know, talk about how important that kind of communication is, where they don't have to have the stigma of coming in to see you all the time. They legitimately are connected, but you can see when they're really having a problem, and you can relate to them electronically in real time if they're tempted to use again.
For us, because we provide case management and treatment, and then we also have certified recovery specialists, we see it as being incorporating it into both the case management and the treatment side to kind of make sure that the client is insulated. So when you're doing the 4 questions, when we get to that point, the way that the person answers the responses, then you can select who you would want to get the responses or be alerted if something's in question. If a client, because of the geo-fencing that's built in, if a client goes into an area that you're familiar with, that's where they got a substance and that trigger, then we could be alerted, whether it be one of our recovery specialists, it could be a family member, it could be a friend, it could be one of our clinical staff, it could be everybody. But that would give us the information to immediately follow up with that client, to hopefully be able to reach out to them, to let them know that we care, to provide some support so that the person wouldn't relapse, because we know relapse can lead to death. So we see it as a lifesaver. When you look at some of these questions, it creates that pause, especially for the 4 point, when you get to the 4 question process. When you, and we joked a little bit, but when it's that pause before you get that second or third piece of chocolate cake. But for our clients, it's the difference between them using something that they could overdose and they could die. So it's that pause for 5 seconds for someone, or for 5 minutes, or for 10 minutes, for that time for someone to be able to reach out to them and say, I care, what do you need? Do I need to meet you at a meeting? It provides that extra support. It's that fail safe a little bit for our clients.
Matt, the isolation that people have seen because of the pandemic has only, it seems that we've learned has only intensified. And what I mentioned just briefly a bit ago, what has been passing for telehealth is not really telehealth. It's not in a real sense, has only exacerbated the problem for a lot of these people. Have you seen that?
Yeah, so so this video connection we're having, and because of waiver 1135, that utilizing an aspect of telemedicine and telehealth has definitely broke down some barriers and at least allowed us to touch an isolated population. It could have been on the outside. In the normal health systems, if you had diabetes, you were dialed into a whole system and you could reach it from your MyChart or whatever it needs to be. But I think what we're finding, because of what's taken place by embedding the technology, as Melissa and Diana were referring to, the type of messaging that can be sent to the patients, those are subconscious drivers that initiates that pause and brings them back to a thought. And that pause makes a huge difference if you're reaching for a pecan pie or if you're going to go chasing down that urge for a substance. But if you're surrounded with the community wrap and you have some technology embedded, that technology actually feels like home to you. It's a front door. It's also a way of reducing stigmas and empowering you. So the beauty of having the ability that somebody may be floating off to the side a little bit and we get an alert, the person that's going to react to them is going to be communicating with them to punch in the subconscious drivers to get that thought process. And if for every time somebody goes down the right side of the road instead of staying in the middle, if we can impact that by 20 or 30%, then we keep that the recovery process moving forward. And that's what I feel that the technology is there for. It's the push notifications that can go out throughout the day. It is the ability that somebody went off the radar a little bit and we know that they have a spiritual bringing, a feeling that gets them prompting and cueing, and maybe it's the pasture or the sponsor who is hitting them immediately, which, just gets that little break and that clarity. And that's what the behavioral science component will do. And again, it's the cog in the wheel of everything else that's going on. It's not the only piece. I hope that answered your question as far as how I see the technology allowing the behavioral science to impact and start motivating and changing behaviors.
This has been the quickest half hour in history. Let me just for a second, if I can ask Diana, if you have any final thoughts in the last 30 seconds.
We found it to be a very beneficial process and tool to work with our patients. We're very excited to see what the next level is. It gives us so much insight into how we approach our patients on an individualized matter. And we have seen that our patients respond so well. So we're very excited to the next level and see what the 4 questions will bring us. And hopefully we get to conquer the disease of addiction.
Melissa, final thought?
Sure. So our biggest excitement with this process is, since we came on board with this, we actually invited all of our providers in Fayette County to participate in the surveys. And we had a meeting, all the providers came. That never happens, to be able to get all the providers in Fayette County in one room together. And Matt and I are going to reach out to do some follow-up training with everybody, but everybody's excited to be involved in this process, to be able to help clients. There's such a benefit, especially for us for the survey, but knowing that the end result is going to be those 4 questions that will be a game changer for everybody.
Well, Diana, Melissa, Matt, thank you. Ken, thanks for letting us all be part of this. Thank you to everybody who gave up part of their day to be with us. Go to the Mind Genomics booth. There's a website that you can go to as well, Mind Genomics, and we've got connections to any additional information. We're all happy to talk to you, and thank you for putting this program on, letting us be part of Lunch and Learn.
Thank you.
Thank you.
Okay, we want to thank our panel for that insightful presentation. Check out their booth, and we want to make sure that you look in the chat. I know they also dropped a couple of links in there regarding their articles, but we want to encourage you here at For New York, if you haven't already done so, please complete the YVM survey, the policy survey, and click on the agenda at the top of your screen to join us at 1 p.m. for our next session. So these are the next 3 sessions that are happening. Afrocentric Recovery with Lori Johnson Wade, building a family peer support program. What have we learned along the way with Bruce Deckert, Timothy Gulick, and Rick Lepowski? And our peer social media influencers navigating public-facing interactions in a digital world with Megan Hetfield and Sheila Powell.